So coronary artery heart disease in simple terms is actually narrowing of the heart arteries. Now the commonest cause of narrowing of the heart arteries is due to cholesterol deposits. There are other risk factors such as high blood pressure, diabetes, smoking, and obviously high cholesterol, and of course genetic factors as well that will predispose you to this narrowing of the heart arteries. Now, when the arteries get sufficiently narrowed to impair blood flow to the heart muscle, that is where we call it coronary artery heart disease. There are, of course, varying severities of coronary artery heart disease, and I think what most patients who have risk factors want to know is that do they have anything that would be significant enough for them to get a heart attack. So if the blockage is sufficiently severe, then patients may have symptoms. The common symptoms described is often a chest tightness or shortness of breath on exertion. However, there are many patients who do not have typical symptoms, or they may have no symptoms at all. For example, if you look at the statistics from the American Heart Association, up to as many as 2/3 of patients who get a heart attack and have sudden death do not have preceding symptoms or do not give a history of symptoms prior to that. That's why heart attack is often called a silent killer. Less typical symptoms would include, for example, patients getting neck tightness, discomfort radiating down the left upper limb on exertion, and some call it jaw tightness. This is less common. But in the elderly people, sometimes the symptoms are very non-specific, and it could be something like just a bit short of breath on walking or exertion. Very, very non-specific symptoms.